ನಾ ಹೋಗಿ ತಗೊಂಡ್ಬರ್ತೀನಿ. ಇಲ್ಲ ಇಲ್ಲ ಇಲ್ಲ, ಪೋಸ್ಟ್ಪೋನ್ ಮಾಡಿಲ್ಲ. ಓಕೆ. ಆಯ್ತು ಆಯ್ತು ಆಯ್ತು. ಆರಾಮಪ್ಪ, ಆರಾಮ್. ನೀವ್ ಆರಾಮಲ್ಲ? ಅದೇ. ಹಾ, ಇವತ್ತೇನೋ ಹೋಮ ಪಾಮ ಇಟ್ಕೊಂಡಾರಂತ, ಅದೇನೋ ಲಾಜ ಹೋಮ ಅಂತ ಏನೇನು ಇರ್ತಾವಲ್ಲ, ಗೊತ್ತಿಲ್ಲ. ಅದೇ ಅವ್ರು ಮತ್ತೆ ಇವತ್ತು ಆಚಾರ ಲೇಟ್ ಆಗಿ ಬಂದ್ರಂತ, ಹೋಗ್ಬೇಕಾಗಿತ್ತು ಇಷ್ಟೊತ್ತಿಗಾಗ್ಲೇ. ಅವ್ರ ಆಚಾರ್ಯ ಇವಾಗ ಬಂದೊಂದು ಅರ್ಧ ತಾಸು ಆಯ್ತಂತ ಶುರು ಮಾಡಿ. 2 ಗಂಟೆ ಮೇಲೆ ಬಂದ್ರೆ ನಡೀತದ ಅಂತ ಹೇಳಿದ್ರು. ನನಗೂ ಆಕ್ಚುಲಿ ನಮ್ದು ಕಾನ್ಫರೆನ್ಸ್ ನಡೀತಾ ಇದೆ, ಒಂದು ಇದು ಸೆಷನ್ ಜಡ್ಜ್ ಮಾಡ್ಬೇಕಾಗಿದೆ ನನಗೆ. 2:30 ತನಕ ನಾನು ಬಿಸಿ ಇದ್ದೀನಿ. ನಾ ಇಲ್ಲ ಇಲ್ಲ, ಅವ್ರಿಗೆ ನಾ ಬರಂಗಿಲ್ಲ ಅಂತ ಹೇಳಿದ್ದೆ ಮೊದ್ಲು. ಇಲ್ಲ, 2:30 ಆದ್ಮೇಲೆ ಬರ್ರಿ ನೀವು, ನಿಮ್ದು ಹೋದ್ಮೇಲೆ ಅಂತ ಹೇಳ್ಯಾರ. ಅದೇ ಶುರುವಾಗಿದ್ದೆ ಲೇಟ್ ಅಂತ. ಮಮ್ಮಿ ನೋಡ್ತಾಳ, ಮಮ್ಮಿ ಒಬ್ಬಕಿನ ಹೋದ್ರೆ ಹೋಗ್ತಾಳೆ, ಇಲ್ಲಾಂದ್ರೆ ಅಕಿನ ನನ್ನ ಜೊತೆಗೆ ಬಂದ್ಬಿಡ್ತಾಳೆ 2:30 ಪೌಣೆ 3. ಹ್ಮ್. ಸರಿ ಆಯ್ತು. ನೀ ಅದೇ ಅವ್ರಿಗೆ ಕೀಲಿ ಕೊಟ್ರೆ ಅದು ನಂಗೆ ಅಡ್ರೆಸ್ಸು ಲೊಕೇಶನ್ ಕಳಿಸು ಅಷ್ಟೇ. ನಾ ಶನಿವಾರ ಬಂದು ಕಲೆಕ್ಟ್ ಮಾಡ್ತೀನಿ ಅಂತ ಹೇಳ್ಕೊ. ಆಮೇಲೆ ಅವ್ರ ಫೋನ್ ನಂಬರ್ ಕಳಿಸು, ಯಾಕಂದ್ರೆ ನಮ್ಮ ಮತ್ತೆ ಫೋನ್ ಮಾಡಿ ಅವ್ರಿಗೆ ಹೇಳ್ತೀವಿ. ಫೋನ್ ಮಾಡಿ ಯಾವಾಗ ಬರ್ತೀನಿ ಹೇಳ್ಬೇಕಲ್ಲ. ಆಯ್ತು ಆಯ್ತು ಆಯ್ತು. ಹ್ಮ್. ಅದೇ ನೀವು ಬರ್ತಿದ್ದೀರಾ, ಚೇಂಜ್ ಮಾಡಿರಾ ಅಂತ ಕೇಳ್ದ. ಇಲ್ಲ, ನಾನಂತೂ ಬರ್ತೀನಪ್ಪ, ನಾ ಏನು ಚೇಂಜ್ ಮಾಡಿಲ್ಲ. ನೋಡಿ
Good afternoon, everybody. We're just waiting for another judge to join us, and we'll be starting soon as soon as he does. So just, I think it'll take another 5 minutes. That's all.
Good afternoon. Is anyone keeping a time while the participants are presenting? Because we will be busy judging. We
Yes,
don't
sir.
have. Yeah. Okay. What is the system? Is there any bell or anything?
So we'll keep the timer on our phones, but we wouldn't want to disturb the participants. So after 5 minutes, we'll unmute ourselves and we'll tell them that 1 minute is left, because otherwise the beeping sound might disturb the
Okay.
presentation.
Yeah. Some system. Okay. Some
Yes.
system. Yeah. Okay. And we should also know that they have crossed the time or they have not crossed the time. How do we know? That's what is my point.
Yes, sir. We'll let you know. So as soon as 5 minutes get over, we'll let you know. And at the end of 6 minutes as well, we'll stop the participants. Sir.
Okay. Thank you.
Okay. So just 2 minutes, sir. We're just waiting for the other judge.
Yeah, I know. Yeah, without judge we can't start. That's true.
Yes, sir. So sorry, sir. Just so sorry. Just waiting.
Because looking at this, I have fixed some other assignment. I thought we will finish by 2:30. I think still we can make by 2:30. Only 6 participants, right?
I think yes, sir. Yes.
Yeah. So maximum 45 minutes we should finish. Yeah.
Yes, sir.
Yes, ma'am. Dr. Shailaja? Dr. Shailaja? Can you hear us?
Dr. Shailaja, are you there with us? Ma'am, you're not audible to us.
Unmute her.
Sir, she's unmuted, sir.
Some problem with her. I think she logged in with mobile.
Yes, sir. I think so. She's logged in with mobile.
Ma'am, log out and log in again if there is a problem with the audio.
We'll just try to contact her again.
Yeah. ಮೇಡಮ್ ಡಾಕ್ಟರ್ ಕುಲಕರ್ಣಿ ಮಾತಾಡ್ತೀನಿ. ನೀವು ಜಾಯ್ನ್ ಆಗಿದ್ದೀರಾ? ಅದೇ ಅವರು ಅದೇ ಅಂತ ಇದ್ರು, ನಿಮ್ದು ಆಡಿಯೋ ಕೇಳಿಸ್ತಾ ಇಲ್ಲ ಅಂತ. ನೆಟ್ ಪ್ರಾಬ್ಲಮ್ ಇರ್ಬೇಕು, ಯಾಕಂದ್ರೆ ಇಲ್ಲಿ ನಮ್ಗೆ ಯಾವ್ದು ಪ್ರಾಬ್ಲಮ್ ಅನಿಸ್ಲಿಲ್ಲ. ಯಾಕಂದ್ರೆ ಎಲ್ಲರೂ 7 people ಆರ್ ದೇರ್ ಆಲ್ರೆಡಿ. ನಿಮ್ ಸೈಡ್ ನೆಟ್ ಪ್ರಾಬ್ಲಮ್ ಏನಾದ್ರು ಇದೆಯಾ ನೋಡಿ. ಒಂದ್ಸಲ ಲಾಗ್ ಆಫ್ ಆಗಿ ಮತ್ತೆ ಲಾಗಿನ್ ಆಗಿ ಟ್ರೈ ಮಾಡಿ ನೋಡಿ. ಓಕೆ ಫೈನ್. ಓಕೆ, ವಿ ವಿಲ್ ವೇಟ್, ನೋ ಪ್ರಾಬ್ಲಮ್. ಆಯ್ತು, ಓಕೆ ಮೇಡಮ್. ಓಕೆ. Hello.
Yes, sir.
I just talked to Dr. Shailaja. She says she's not able to join. Some net problem, maybe, I don't know.
Yes, sir. Can she log in again through another
I
device?
told her the same thing, log out and log in. So she has logged out. I think she'll log in again. Try and log in again.
Yes.
Maybe net problem from her side, I think.
Yes, sir, probably. Dr. Shailaja, can you hear us?
Yes, hello.
Yes,
Yes, ma'am, you're audible, ma'am.
Good afternoon, ma'am. Can we
Good
start the
afternoon.
session, ma'am?
Yes, please.
Yes. Good afternoon, everyone. Welcome to the 32nd State Level Annual Conference of Karnataka Association of Community Health, hosted by Ramaya Medical College. The topic for this year is redefining public health, COVID-19 and beyond. With this, we shall begin our session. I take this opportunity to introduce our esteemed judges, Dr. Annarao Kulkarni, who is a professor in East Point Medical College, and Dr. Shailaja Patil, professor and head in BLDE Medical College, Bijapur. We are thankful for dedicating your precious time for judges in this session. Today's session will be moderated by me, Sharanya R.
Me, Surbi.
We are 7th-term students from Ramaya Medical College. Can we go through the participants once, ma'am, and judges? So, can you verify us the judges?
Can we
Participants
verify
list?
the participants list with you, ma'am? And sir?
Yeah. Okay, I have to read out the names of the participants.
Yes, sir.
Number 1 is Naresh Kumar. Number 2 is Jannat B.
Yes, sir.
Number 3 is Rudrama. Number
Yes,
4 is Ipsita. Number 5 is Vijay Kumar. Number 6 is Chandni.
Also, sir, there's a change in the order. So, Dr. Ipsita will be presenting first, followed by the others.
Yeah, no problem.
Okay.
Yes, I would like to brief the instructions. Every participants get 6 minutes for the presentation, and the judges can ask the question for 2 minutes. With this, can we start a session?
Yes.
Yes. Dr. Ipsita, I'll be sharing the control so that you'll be able to present.
Okay.
Ma'am, I have given control. You should be able to present now.
So I should share my screen now.
Yes, ma'am. Not the PowerPoint presentation. You should share the screen.
You mean my desktop, is it?
Yes, ma'am. Yes, ma'am. You can open your presentation now.
Okay.
Ma'am, your PPT is visible. Can we start the timer?
Yes.
Yeah, sure. It is visible.
Ma'am, we'll remind you at the end of 5 minutes that 1 minute is left, and we'll be stopping the timer at 6 minutes.
Okay.
Yes.
Good afternoon, everyone. Good afternoon, sir. Good afternoon, ma'am. I'm Dr. Assistant Professor at CD Cymer. So my research topic for today is a community-based study of milk adulteration and its association with nutritional status in children aged 1 to 5 years in a selected Bangalore rural district. Now, in this picture, I just want to project, as per the NFHS 4 data, the burden of malnutrition among under 5s in Karnataka. So we can see the stunting, wasting, underweight prevalence is quite high statewide, and rural does also have almost 1/3 of similar projections of burden of stunting, wasting, and underweight. Now, coming to milk adulteration, we all know milk forms an important part of the diet among the under 5 children. And as per the National Milk Safety and Quality Survey 2018 results, majority of the samples didn't meet the quality parameters. However, the only positive thing that the survey could predict was less than 1% of the sample had adulterants that could affect the safety, which could be totally hazardous for the children. So coming to the objectives of my study, to study the prevalence of common adulterants in milk samples in the households of children aged 1 to 5 years living in the service area of Rural Health and Training Center, to assess the nutritional status of these children using anthropometry measurements, and to assess the association between nutritional status and milk adulteration. Now coming to the methodology, as I already told, the study area was our catchment area of the Rural Health and Training Center, which has a population of over 25,000. So if we take 10% of children, of under 5 children, it would come around 2,500, out of which, based on review of literature and previous prevalence, the sample size was calculated as 180. House-to-house surveys were conducted and data was collected using a pre-tested objective questionnaire, anthropometry measurements, and the raw milk sample testing. Now, the raw milk sample testing, the water was tested by slide test, and the other adulterants, like I have projected and the strip. This strip has been developed from National Dairy Research Institute, which tests for adulterants like glucose, sucrose, neutralizers, H2O2, maltodextrin, and now coming to our results, if we see the socio-demographic details, it is in current trends of any Bangalore rural population. The literacy rate was quite high among the mothers for a rural area. Coming to the gravity of adulteration, in my study sample, 22 samples didn't have any kind of adulterants in them. However, you can see in all the other samples, there were adulterants ranging from 1 to up to 4 also. Now, when we see the frequency of adulterants, the most common adulterants found were neutralizers in almost 54%, followed by maltodextrin. And here I would like to present that more than 1/4 of the sample, they had water as an adulterant, which deprives the child of the much deserved nutrition. Now, coming to the anthropometric indices, we can see the height for age or the stunting data was quite high. It was almost 38%. The undernutrition data was, prevalence was almost 13%. And the wasting or the weight for height was almost 15%, and it was more among boys than girls. Now, when we came to association between nutritional status and adulterants, even though there was no significance found among these two parameters, I would like to project here that all the underweight nutrition and the stunting anthropometry indices where the proportion was higher among the children who drank adulterated milk compared to children who drank unadulterated ones. And no such association was found when it came to wasting. Socio-demographics undernutrition directly associated with the size of the family and the education of the mother. Now, since it is a cross-sectional study, I would like to tell that we could not assess the long-term effects of the milk, and also no direct causation could be established between the nutritional status and the milk adulteration. So, in conclusion, the childhood malnutrition was the prevalence in our study sample was significant and quite worrisome. Malnutrition was proved more prevalent among the boys than the girls, and chief adulterants were neutralizers, and there was major also. So I would suggest that further studies need to be done to establish relationship between these two parameters, that is milk adulteration and the nutritional status of the children. And also quantitative analysis of this adulteration should be done to establish a dose-response relationship between the adulteration. Thank you.
Thank you, ma'am.
Shailaja, you can
Dr.
ask me the question.
Yes, sir. You can continue with the question answer session.
No, Dr. Shailaja first.
Okay, sir. Thank you. Ipsita, is it a novel idea to look at the relation between the malnutrition and milk adulteration?
Yes, ma'am.
The
Actually,
presentation,
yes, ma'am.
yes,
Sorry, ma'am.
the presentation also was good. And my only thing is, even if you are doing a cross-sectional study, if you had an age segregated data where you showed whether they were only on exclusive breastfeeding, because these milk consumption has to be correlated ultimately. Milk
Yes, ma'am.
adulteration overall with the anthropometric, if you could have really delineated children who were consuming the milk, that would have been, I feel, little more relevant.
Yes, ma'am. Actually, ma'am, because of slide number restriction, I couldn't put my exclusion criteria. So apart from excluding infants, I have also excluded children who are on maternal nursing, ma'am. I couldn't put it on the slide, ma'am.
Okay. So that did they really, all these children consume the milk then on a daily basis?
Yes, ma'am. They did consume on daily basis, ma'am. And raw milk sample was collected from every household, which was purchased on that day, ma'am.
Okay. So yeah, that adds a little more objectivity thinking, and only the dose response, as you told, probably had
Yes,
to
ma'am.
be seen that.
Yes,
And
ma'am.
the other morbidity pattern, did you collect the morbidity pattern of these children also in last 1 year? Did you
Yes, ma'am. I assessed the acute diarrheal diseases and the acute respiratory tract infections also, but I could not put it up in the slides, ma'am, because of, again, slide restriction.
Yeah, I do agree, but you can reduce the simple tables or make the tables little more informative with the information multiple variables next time when you are presenting.
Okay.
You can
Okay,
put
ma'am. Okay, ma'am.
multiple variables, and that's my suggestion.
Okay, ma'am. Okay.
Sir,
Thank you.
yeah, this is over to sir next.
Okay. Dr. Ipsita, can you put the your objective slide?
Yes, sir. Yes, sir.
And organizers, can we have a look at the presenter at least for a moment? Is it permitted? Video on for
Yes,
just
sir.
1 moment?
Yes,
We want
sir.
to see who is.
Yes, sir.
Yeah,
They can
because who
keep
is
it all
presenting?
throughout as well.
Okay. Yeah.
Yes,
Okay.
sir.
Yes. Objective slide, please.
It is
Okay.
put, sir.
Yeah, right. See, you have three objectives. You read the first objective.
To study the prevalence of common adulterants in the milk sample in households of children aged 1 to 5 years living in the service area of Rural Health and Training Center.
Yeah, okay. The word study is not to be used if you are, your objective is to evaluate or know the prevalence.
Yes,
Right?
sir. Yes, sir.
Because
Yes.
study word has not to be used. That is one
Yes,
point.
yes,
What is the
yes.
word you know now? You said yes, sir. So what is the word you can use?
To estimate the prevalence?
Yeah, correct. Right. So the
Yes, sir.
estimate is a better word. Right.
Yes, sir. Yes, sir.
Yeah. Okay. Now the assess and estimate. These two are the words which are supposed to be used in objectives, and study, because there are study and study. People, I have studied for hours together, but I may not achieve the
Yes,
at
sir.
the end
Yes,
of
sir.
the, yeah. Right. So estimate means
Yes.
definitely you will know whether you have estimated or you are not estimated.
Yes, sir. Yes,
Okay.
sir.
Okay.
Yes.
Now you have put three objectives. Do you think you have achieved all the three objectives at the end of your study?
If you go by this, like I have presented the objectives in tabular form in the results, sir. But as I told, the limitation of my study, the association, the dose, the response could not be, the causation could not be established. So you need more time, and maybe a case control study would have been better rather than a cross-sectional one.
And I always prefer to have as minimum objectives as possible to achieve the objectives at the end of the study. Okay,
Yes.
you put many objectives and you are not able to achieve, okay, even one of them also, that reflects poorly on our study. So therefore, one objective is always better for me if it is little difficult, because you said there are limitations or whatever reasons. Okay,
Okay, sir.
and if you are sure that you are able to achieve all the objectives, only then you put multiple objectives. Okay,
Okay,
thank you.
okay,
It was
sir.
a good presentation. Thank you.
Thank you, sir. Thank you.
Thank you so much, ma'am, and thank you so much, judges. Let's move on to the next participant now. Our next participant is Dr. Naresh Kumar. Sir, I will be passing the control to you so you can present your screen.
Yeah, thank you. Am I audible?
Sir, you're not visible yet.
No, my voice is audible.
Yes, sir, you're audible. You can also turn on your camera.
Oh, thank you. Yeah, yeah.
You should be able to present now, sir.
I'm visible also now.
Yes, sir, you're visible.
Thank you.
Yes, sir, we are able to see your presentation. Shall we start the timer, sir?
Yes, start.
Okay.
Good afternoon, sir. Good afternoon, ma'am. I'm Dr. Naresh from Sri Rajas Medical College. I'll be talking on knowledge and practices of food safety in the rural population of Kerala. WHO has said that about 60 crore, and at the same time, almost about 1 in 10 people fall ill after eating contaminated food. Diarrheal diseases are the most common illnesses resulting from consumption of the contaminated food, which can lead to almost 55 crore people ill, and more than 2 lakh people get happened. And mainly in order to prevent.
I can't hear you properly. Can you be a little louder, please?
Yes, sir. In order to prevent foodborne illness, food safety and hand hygiene measures are one of the most important ones that have been emphasized, especially in a study conducted by a rural study in Hyderabad, which says that the prevalence of foodborne illness at household level is just 3.2% and shows that 40% of the food poisoning cases occur due to home cooked food. And at the same time, food hazards are detrimental to the health, especially mainly due to some of the ready-made foods that can be because of chemical hazards, mostly usage of pesticides from the agriculture products could have been there. in one of the studies in India has been highlighted. And especially with respect to Indian scenario, because of low socio-economic status and at the same time unsatisfactory environmental conditions, poor personal hygiene, and at the same time poor water supply, because they'll be having very less per capita water supply. Because of that, even for the preparation of the food and even for the store, with respect to the storage also, there can be very bad hygienic conditions would have been there. That can lead to gastroenteritis in many of the among many of the households in Indian uh, conditions. Our objective is mainly to assess the knowledge, attitude, and practices regarding food safety. So we have used cross-sectional study, and assuming that there will be good awareness up to 50%, with the 95% confidence interval, we could achieve a sample size of 267. But the thing is that we have done this particular study in the month of April. Because of COVID has been started within that time, even there was some other study from our department we have done regarding awareness on especially hand hygiene with respect to COVID, that we have done during that time itself. The study subjects mainly we have taken from the Cambodia Primary Health Center, which is very much close to our medical college itself. So there are about three villages we have randomly selected among the 14 villages. And before doing the study in that particular village, we have done mapping of the village and numbering of the houses has been done so that the houses have been included in that in our study. With respect to data collection, home visits were made and the interview of one of the household member who is aged about 18 years have been interviewed, and at the same time by using the administration of food safety and hand hygiene practice questionnaire we have done. The pre-tested and semi-structured question was used mainly to collect the socio-demographic data. So the data, after collecting the data has been entered using Wikidata software version 3.1, and it has been transferred to Spaces mainly to analyze the data. So this particular chart shows regarding socio-demographic details of study participants. So in our study, the mean age was 52 years, and males were more than compared to the females, which is up to about 64% of males. And majority of them did not complete, did not enter schooling itself. And 68% were employed in government or maybe private sector. And majority of them were in class 2 or social economic status according to PG classification. So this particular bar diagram shows regarding distribution of study participants based on knowledge and attitude of food hygiene. So actually about 91% of them have agreed regarding the kids to enroll when they are going to enroll, the food hygiene awareness should be put up to them. And at the same time, majority of them have emphasized mainly well-cooked food should reduce the diarrheal incidence. That is first. And at the same time, about majority of them, about 99% of them have been agreed that good food hygiene definitely will reduce the diarrheal incidence. Coming to the distribution of study participants according to the practice of food safety, so about 83% of the participants have been pre-electronic.
Naresh, sorry, can you really come near to the microphone because it's literally inaudible for us.
Wait.
Yes, I can't. I also can't hear.
And
Hello.
sir, like 5 minutes are up as well.
Hello. Now, ma'am, is it audible?
Yeah, now it is audible. Yeah, continue.
Yeah. And about 81% of the participants, they were used to leave the food for more than 2 hours, and about 94% of the participants used to ensure that food is well cooked before consumption, and almost 70% of the participants used to use different chopping bowl, especially for cutting the vegetables and for cutting the meat, and 98% of the participants were used to wash food properly before cooking. And at the same time, 94% of the participants used to wash hands before cooking and before food preparation. So our main conclusion was that in our study, majority of them had good awareness and practices on food hygiene among the participants, especially in during the social community. And at the same time, we should emphasize especially on practicing hand washing and cooking food, because only about 90% had this particular practice. That at least about 50% were not doing this particular practice. And at the same time, especially, you know that there is a VHSA, that is Village Health and Sanitation Committee is there. So people have, they ask that the intervention regarding.
I'm sorry to interrupt you, sir, but your time is up.
Okay. Our main limitation is that the sample size was 257. We could achieve only 199 because of the COVID which has been happened with March and April, and we didn't that.
Can I start, Shailaja ma'am?
Please ask, sir.
Yeah. Okay. Naresh, when you are presenting in a conference like this, you must ensure that you are audible, your slides are good looking. It appears that your slides are crowded. Do you know the rule of 6x6 when you are presenting a PowerPoint?
Yeah.
What is the rule of 6x6?
So there should be 3 lines should be there, and 3 words should be there.
Can't hear you again. Little louder.
But there should be 6 lines should be there in a single slide, and at the same time there should be 6 or 7 words should be there in a single line.
And you have not numbered the slides. If you want to, ask a question, then the number, will be useful. You have to put the numbers. But anyway, because we were not able to hear you, I can't ask really meaningful questions. Over to Dr. Shailaja.
Sir, thank you. I also don't have much comment because as sir already put it, we couldn't hear 90% of the time. It was just mumbling for us. The second thing is, when you took such a small sample of 267 in 149 what so villages, I really don't understand what was the necessity of so much scattered sampling you did.
We are used only sampling was done in 3 villages among the 14 villages.
Pardon?
We have used 3 villages among the 14 villages, whatever you selected.
You
randomly select 3 villages only.
Okay, 3 villages you selected. So you couldn't complete due to COVID. So was it because of the COVID hand washing, the people told you that they really washed more, all these things? Because you have just started after the lockdown.
Yeah, maybe
that's a big bias, Yeah. I suggest that if you really want to do, you have to ensure again a good sampling technique and without bias. Anyway, the lot of lifestyle changes have happened due to COVID. So I feel that would add quality to the study a little more.
Definitely.
Okay. Thank you.
Thank you so much, sir. Thank you, judges. Let's move on to our next participant. Our next participant is Dr. Jannat. Judges, please note she'll be presenting from Dr. Rudrama's account. I will be giving you the control now, ma'am. Ma'am, you should be able to present now.
Hello.
Yes, ma'am, you should be able to present.
Yeah, kindly give permission to Rudrama ma'am. I'm presenting from her login.
Yes, ma'am, I've given permission to her account.
Is Rudrama presenting or Jannat be presenting?
Myself, ma'am, Dr. Jannat, I'm presenting, ma'am. I'm having technical glitches, ma'am.
It's okay, but you are presenting from her account, that's all. But you are presenting your own paper. Okay.
I'm presenting my own paper, ma'am.
Okay.
Ma'am, you can share your screen.
1 minute, I'm sharing.
Yes, ma'am. What if somebody wants to present? Ma'am, please share your whole screen, not just the PPT.
Okay. 1 minute, I'm just
Yes, ma'am.
ये कुछ आया ना? It's not come. It's taking time to load. Is it-
Ma'am, do you want us to present from our system? I think we have the
No, no,
presentation.
no. It's sharing now. It's started.
Okay.
My, hello everyone. My screen is visible.
Yes, ma'am, it's visible. We'll be starting your timer now, ma'am.
Good afternoon, everyone. Today I'm presenting my oral presentation on effectiveness of clickers on undergraduate medical students by myself and Dipti madam. My screen is not coming.
Yes, ma'am, the slides are not changing.
Yeah,
I hope
some problem is there.
presented the entire screen, not just the PPT, ma'am. When you're choosing share screen, choose
Yeah.
share the whole screen, not just the window or not the PPT.
Where the option is there? Screen one. This one.
Yes, ma'am. Share screen, share the whole screen. Yes, ma'am.
Okay.
We'll restart your timer, ma'am. So
Yeah.
yes,
Now
ma'am. Now, not the PPT is not visible, ma'am. You have to open it.
Yeah. I'm just opening.
Yes, ma'am.
Now it's visible. Hello.
Yes, ma'am. Yes, ma'am. It's visible now.
Yeah.
Ma'am,
Thank you.
just try changing the slides once before we start.
It's coming.
Okay. Yes, ma'am. Okay, ma'am. You can start.
Thank you. Good afternoon, everyone. Today I'm presenting on effectiveness of clickers on undergraduate medical students learning. Assessment forms an important part of teaching learning strategies with the implementation of CBME. It can be formal or informal, and one of the informal assessment types is clickers. Public English and without having to worry about more local students dominating. It's a very easy to leads to class. For this card, this graduate medical students learning and to assess the perception usage of clickers among phase 3 undergraduate medical students. Study amongst carried out in Gayak Institute of Medical Science. The study tool was Kahoot basic software for clicker was used for formative assessment. Pre-design and pre-check questionnaire was used. Ethical approval and reformed consent was obtained. The 6-term medical students, for them, an interactive lecture was given. The sample size was 80 and the sampling technique was used for purposive sample. After the interactive lecture, they were divided into 2 groups, each of 40 students. The group A, they were assessed with clickers. Then for peer discussion, 10 minutes were allowed. After then, again, they were assessed with the clickers. Then they were assessed after 1 week from the first assessment using the clickers. Whereas the group B, for 40 students, they were assessed with group discussion. And after 1 week, again, they were assessed with group discussion. A crossover was done after 2 weeks from the first assessment, where the group A were assessed with group discussion, whereas group B were assessed with clickers. At the end, all the students were assessed for their perception regarding usage of the clickers. Analysis data was coded and entered in the Excel sheet. It was analyzed using proportions, chi-square test, t-test, and correlations using SPS version 21. Distribution of the study participants. Majority around 47 were 20 years old, 27 were 21 years old, whereas 71.25% were resides in urban area and 70% belongs to upper class, which was statistically significant. The academic scores of the students of Group A by the Clucas during the first assessment were mean were 13.6 plus or minus 3.6, which increased after the peer discussion in the second assessment, which was 16.8 plus or minus 5. And even after 1 week, it increased to 18.0 plus or minus to 4.6. And it remained higher when they were crossed over to group discussion, that is 16.0 to plus or minus 5.3. Whereas the group discussion score for the group B, for the first assess, the score was 15.7 plus or minus 2.7. And after 1 week, the score increased to 16.6 to plus or minus 3.4. And when it was crossover to clickers, the score reduced to 15.8 plus or minus 2.6. It shows here the score between the first and second assessment. It was statistically significant. Therefore, peer discussion had significance. And the correlation between clickers and group discussion scores. There was a positive correlation around 0.725 between the clicker first assessment and clicker second assessment. And there was a positive correlation between clicker first and second assessment with group discussion first assessment, and clicker assessment after 1 week with the group discussion after 1 week, and clicker assessment after 2 weeks with the group discussion after 2 weeks. And the student perceptions. Regarding this, 78.8% believed that clickers were easy to use, and majority of them believed that clickers were well integrated into the class, and they felt more engaged because of use of clickers, and they interacted more with the students. Whereas 53 believed that clickers contributed significantly to their learning, whereas 54 said clickers improved their performance, and 58% said they enjoyed using clickers as formative assessment, and 51 said clickers score reflected their performance. The conclusion was student who used clickers with peer discussion had mean score higher than the student who used group discussion, and it remained higher even after crossing over to group discussion. And clickers helped in better understanding of the subject, leading to better knowledge and performance. The take-home message was clickers is a fun and effective method of student learning and easy to administer. It helps in assessment and provides structured feedback to all the students during the same lecture that improves student-teacher interaction and learning. The limitation was it can be carried out to assess the long-term impact where we have not done. Then the recommendation is it can be routinely used in the class as an educational tool. I want to acknowledge the Dome faculty of JNMC Belgavi for their support and guidance, and Dr. Rudrama ma'am for her support during data collection, and the students of JIMS Kadak for their cooperation, and our director, HOD and the staff for their support during my study period. And these were my reference. Thank you, everyone. Hello.
Thank you, ma'am. Thank you for your presentation, ma'am.
Thank
Over
you.
to the judges.
Okay.
Dr. Shailja, you can start.
Sir, please, you start, sir.
I will start. Okay. Again, Jannat, your presentation was good, and the topic
Thank you,
is
sir.
also really good as far as I'm concerned. But
Thank you, sir.
one or few points, like the previous presenter, you have not numbered the slides. See, remember, you are
Yes,
all
sir.
faculty, and when you
Okay, sir.
are presenting in a conference, you must always number the slides. Okay.
Yes, sir. I'll do
Yeah.
next time, sir.
Right. Again, the same question like previous. Did you achieve your objective? You put the objective slides.
Yes, sir. I've achieved my objective, sir.
How do you say you have achieved? Yeah.
Sir,
To assess the effect. Yeah, effectiveness on phase 3 undergraduate medical students learning. To
yes, sir.
assess the perception of usage of clickers among phase 3 undergraduate medical students. Okay.
Yes, sir.
Yeah.
Yes, sir.
So,
Sir,
why don't you? Yeah.
hello,
Yes.
sir.
Continue.
Sir, for first objective, sir, I'm not able to project here because of the limitation. Many slides were there, sir, regarding this, in which I have done paid t-test, in which the significance was done of the effectiveness of the clickers and also the peer discussion. Therefore, to show you the significance, I have sir, to show the interrelation between the time and the scores between the clickers and the group discussion, sir. And another slides I have done to show the relationship, whether the scores be in between the clicker scores, whether it varies with the time, whether it improved. And I have taken a comparison with the group discussion, sir, because both are the active learning. So I don't want to compare with the normal because it was logically more. So I have taken group discussion, which I have compared. And here the relation was positive and it showed more in the clickers than the group discussion. And the perceptions are here in each slide. I have prepared one table which I'm not able. This is the brief presentation of my student perceptions, sir, which I have presented here. In detail, I have taken regarding their implementation, whether specific learning objectives were implemented perfectly or no, whether negative questions were added, whether clickers were frustrating to use, whether time was allotted equal or no, whether the personality, gender, or any other factor affected the use of clickers. Many factors were added, sir. This is my brief presentation, sir, here.
Okay, good. Okay.
Thank you, sir.
Dr. Shailja, you can take over.
Yes, sir. Thank you. Janat Bey, it's a nice innovative topic, and I think you have a good data. Only thing is you couldn't put it here.
Yes,
I
ma'am. Thank
think
you, ma'am.
yeah, it's a nice concept also. Crossover design is used, so it gives more credibility for
Thank
your
you, ma'am.
data and for your publication later, I feel. So
Thank you, ma'am.
in the methodology, you could have just told instead of plain numbers how many children were involved. You can
Yes,
always
ma'am.
explain what type of clickers you have used. Like, is it on specific topic did you use
Yes,
and
ma'am. I have done, ma'am. I have done on Diptera, ma'am. Here, Diptera interactive lecture was given on Diptera, ma'am. When the assessment was done, the concept remains same, ma'am, but the questions were changed because they should not, because of to avoid the recall bias. In the first assessment with clickers, I have used the same concept, and the second assessment, the questions have changed, ma'am. The concept remains same, like type of diarrhea, type of dehydration, then how much ORS is required in case of dehydration, ma'am. Yeah.
okay. That's what in methodology, when you are writing for a paper, I'm telling anyway, the presentation is short. So you have to
Yes, ma'am.
explain it in correct so that the person who is reading understands.
Yes, ma'am.
And there are no undue questions from reviewers. That's my
Okay, ma'am.
suggestion.
Yes, ma'am.
Okay.
Yes, ma'am. Thank you, ma'am, for your suggestion.
Thank you so much, ma'am. Thank you, judges.
Thank you.
Our participant is Dr. Rudramma.
Yeah, 1 minute, I'm not able to show. Okay.
I think you can just start your presentation on the same screen.
Madam, I'll to madam.
Yes, yes.
Hello.
Yes, ma'am, we can see your presentation. We'll be starting your timer now, ma'am.
Good afternoon, everybody. Myself, Dr. Rudramma from James Gadak. Today, I'll be presenting my study reception against doctors at a government hospital in North Karnataka. Today's healthcare scenario is scrutinized for the quality of care provided and patient satisfaction. POSCO in 1983 described patient satisfaction as the individual's experience versus the expectations of healthcare service provided. Why this is important is because patient satisfaction is related to non-compliance, delay in seeking healthcare, or whatever the medical advice being followed or not. According to the IMA studies, 75% of the doctors have faced some kind of violence at work. So in this, we had planned this study with the objectives to estimate patient satisfaction with healthcare provided at government hospital with the help of PSQ 18 questionnaire and to assess patient perception of violence against doctors. Coming to the methodology, the study design was a hospital-based cross-sectional study at JIMS Teaching Hospital, Gadag, for a period of 6 months. The study population consisted of patients 18 to 60 years who were admitted for a minimum of 24 hours. Those who were well-oriented to time, place, person were included, and patients with psychiatric problems were excluded from the study. Sample size was calculated using EpiInfo software with assuming satisfaction of 50%, confidence level 95%, and 7% error. Purposive sampling was carried out, ethical clearance was obtained, and after taking informed consent, data was collected by oral interview method, and it was analyzed by SPSS software version 16, using descriptive and Pascal-Wallis test for significance. Coming to the results, majority of them were males, that is 54%, and 18 to 32% constituted again the majority of the study population. Hindus were more in the study population. Illiterates were around 26.5%. Class 4 people belong to class 4, that is 39%. Major departments included were the medicine and surgery. Based on the bed ratios, the following departments where the patients were selected. Duration of admission, 31% were admitted for more than 3 days. Coming to the satisfaction, the overall satisfaction scale, the median score was 3.78 with a interquartile range of 0.44. The satisfaction was again subdivided into many subscales, that is general satisfaction, technical quality, interpersonal manners, communication, financial aspect, time spent with doctors, and accessibility and convenience, all of which the median score was 4, except for the accessibility and convenience, which had the least score, that is 0.75 median score. This is one because our hospital is located at the outskirts of Gadag. Since it is a new building, the area is slightly outskirts. Now coming to the perception of those patients with respect to violence against doctors. We had 47.5% of them they had heard about the violence against doctors. 56.5% considered doctors next to the God. 11.5% of them had received shouting from the doctor when they had asked questions regarding their problems. 46.5% of them agreed to patients that they may be wrong on what about the patient, the doctor been addressing to them. They may be the wrong part, may be on the patient side. 21% of them had seen violence, that is verbal violence against doctors, either from the patients or the patient relatives, and 8.5% of them had seen physical violence against doctors. And regarding the justification against the violence against doctor, 57.5% of them said no, that is not right. 60% agreed that those who are involved in violence against doctors should be punished. 35.5% would involve in verbal abuse. There was a question that if there was a situation wherein their family member was in emergency and there was a delay from the doctors, would you resort to violence? 35.5% of them said yes, and most of them agreed to verbal violence if they had to go in for. And in case of situations where doctor was being assumed, whether they would stand up for him, 66% of said they would support the doctors.
I'm sorry to interrupt you, ma'am, but your 1 minute is left now.
Yeah, okay. According to the test of significance, we had age that is 48 to 60 age group people were more satisfied. With respect to religion, Hindus were more satisfied. With respect to socio-economic status, class 2 and class 3 study subjects were more satisfied. With respect to the department, obstetrics and ENT were the most satisfying departments to the patients, and whereas chest and TB was the least department where they were satisfied. Duration of admission, more than 5 days of admission, people were more satisfied. All these associations were significant. Our findings of median or scores of satisfaction 3.78 was similar to a study done by Avinash et al. At SDM. That was but a community-based study, and the subscale scores were also similar to the same studies. With respect to violence, people said that 57.5% were unethical. That is, violence against doctors is unethical. And we had in the north parts of India where 62% of the patients felt that the violence against doctor is
Sorry,
on
ma'am,
rise.
but your
Thank
time
you.
is up now.
Yeah, thank you. These are my references.
Thank you, ma'am. Judges can proceed with the questions.
Shailija ma'am, please start.
Okay, sir. Dr. Rudramma, the topic is relevant.
Yes, ma'am.
With increasing number of violence against doctors, it's a good topic. And
Yes, ma'am.
and you did mention about the exclusion criteria of psychiatric patients.
Yes, ma'am.
What I suggest is it's basically a very perception-based study.
Yes, ma'am.
At that point of time, and
Yes.
and there are no yes or no answers for all these questions. You know,
Yes, ma'am.
when you are framing such type of questions, the binary variable or yes or no are not desirable outcomes. You know,
Yes, ma'am.
I respond the question depending on my circumstance on that day, on my mood. So many
Yes, ma'am.
times for such type of questions, we do ask graded things.
Yes, ma'am. Yes,
We
ma'am.
give ranking order, and
Yes,
we give
ma'am.
around 3 to 5 options. I think you might be knowing about this.
Yes, ma'am. Yes, ma'am. I agree.
So
Strongly
could
agree. Yes, ma'am.
it is good that if you use such type of case for such type of studies rather
Yes,
than
ma'am.
just yes or no, you know, for
Yes, ma'am.
this.
Got. I
That
understood,
is
ma'am.
yeah. So the better you can use. That's one
Okay.
strong suggestion.
Yes,
And
ma'am.
and also, you know, you can see, although you are taking significant associations for some type of services, you can make out that those which involve surgical procedures will always have higher satisfaction because
Yeah.
of the
Yes, ma'am.
immediate result, and the
Yes, ma'am.
chronic conditions always will be
Yeah.
unsatisfactory.
Yes, ma'am. Yes,
So,
ma'am.
so when you are, if at all you are writing this as a paper or again presenting somewhere, keep these biases at the back of the mind, and in discussion you can include. That's my suggestion.
Yes,
Thank
ma'am. This since there was time limitation, the other we have made even department wise the subscale variations and all, because there is no time here, ma'am. We have not gone into the details. There is a lot of bias with that initial table. We can't judge anything.
Yeah,
Thank you,
you
ma'am.
can even make it as a community-based study to
Yes,
elicit to replace lot of these biases, geographical access, all those things. And
Yes, ma'am.
persons only coming to Gadag Institute cannot be generalized. So when you really want to go for publication, these will be your real limitations. People
Yes,
will
ma'am.
not be interested in reading what patients thinks about GIMS or BLD or something like that. It should
Yes,
be
ma'am.
more community based and broad so that people readability increases.
Thank you, ma'am.
Rudrama, again, same point, no slide numbers. So I want you to open the table number 4. I don't know which slide number is that.
Yes, sir. Yes, sir.
Yeah. Now you see, there are relation between religion and satisfaction. Okay,
Yes.
what is the interpretation? How do you interpret this? Is there any real meaning in religion and satisfaction?
No, sir. Nothing like that.
Yeah, because I want, if you are trying to find out association, yeah, we generally take these things, age and sex and religion and other things we generally take. But when we are talking about something which is a meaningful association,
Yes,
then you will have to, think of the points. And even most of your slides are again crowded. There is no need to put everything in one slide only if you want. Okay,
Yes, sir.
you can put it in different slides.
Yes, sir.
And yeah. The first thing I want to look at when I am attending these presentations is good looking slides. Everybody
Yes.
wants, okay, good looks nowadays. Okay, anything you take in life, good looks are important. Slide should be attracting the audience. And
Yes, sir.
more important than the looks of the slides are the content that is there in the slide. That should be readable by the audience. Okay,
Yes,
and
sir.
more important than that is how you explain what you have written in the slides. Right? These
Yes.
3 points, this is general advice for everybody. But yeah, topic is really good. Introduction, can you go to the introduction again? I don't know the slide number.
Yes, sir.
Introduction slide. Last point, you see, Indian Medical Association, up to 75% of the doctors have faced some kind of violence at work, right? Now,
Yes, sir.
you have put the reference number right. You have quoted from Indian Medical Association, 75% of the doctors in Karnataka, in India, in the whole world, or only in Gadag, I don't know. Okay. Now
Yes,
this
sir.
becomes a statement. I'm not blaming you. Okay, you have
Yes,
quoted from somewhere, but you must put it there. 75% of the doctors in, right?
Yes, sir.
In the state or in the country, because this is a blanket statement. 75% of the doctors. I might not agree with such things, right? So these are some general observations. Otherwise, the topic
Okay,
is
sir.
really good. Yeah. Okay. Thank you.
Okay. Thank you, sir. Thank you, sir.
Thank you so much, ma'am. Thank you, judges. Let's move on to our next participant, Dr. Vijay Kumar. So I will be giving you the control. So you should be able to present now. Dr. Vijay Kumar, are you with us? Dr. Vijay Kumar?
Am I audible, ma'am?
Yes, sir. Now you're audible, sir. So you can present. I've given you the control.
Am I sharing my screen?
We can't see your screen yet, sir.
Organizers, I have a request because after another 10-15 minutes, I cannot be available because I have a webinar talk at 3 o'clock.
Yes,
So
ma'am.
Even same with me. I think 5 minutes we will give it to the last two presenters. Okay, we will definitely give you credit for whatever you have done, but try or restrict your time. Don't overshoot.
Okay. So the last two participants, Dr. Vijay Kumar and Dr. Anthony, you'll have 5 minutes each for your presentation.
Okay, ma'am.
Dr. Vijay,
Am I sharing now?
yes, sir. You can start now, sir.
Good afternoon, everybody. I am Dr. Vijay Kumar, Assistant Professor, Department of Community Medicine, KIMS Koppal. I am presenting a study titled An Analysis of Water Sanitation and Hygiene in Koppal, Karnataka, a household survey. Coming to the introduction, increasing access to water, sanitation, and promoting adequate hygienic behaviors can reduce the burden of diarrheal diseases. And definitely diarrheal diseases are leading causes of mortality among under 5 children. Water sanitation and hygiene are vital indicators to healthy living and safe environments for development of any community. Poor protective behavioral practices and inadequate wash standards are associated with increased morbidity and mortality, particularly in low socioeconomic countries like ours. And also, ensuring access to safe water and adequate sanitation are one of the sustainable development goals to be achieved by 2030. With this background, we have done the following study with the objectives to estimate the proportion of population having access to safe water and adequate sanitation in the study setting, to estimate the prevalence of hand hygienic practices among people in the study setting, to determine the association between various environmental factors and diarrheal episodes among people residing in those households. Coming to the materials and methods, this was a cross-sectional community-based study done for a duration of 5 months from March 2019 to July 2019 in the urban field practice area of KIMS Koppal, and the study population included all the households in the urban field practice area of KIMS Koppal. Sample size calculation, minimum sample size calculated was 400 with an absolute precision of 5% and significance level of 0.05, taking 48% prevalence of appropriate wash practices from a previous study done in Karnataka. We included 410 households in the present study. Sampling technique used was simple random sampling. We used pre-tested and semi-structured WASH questionnaire prepared by modification of the questionnaire provided by Global WASH Master. And we used EpiInfo software version 3.5.4 for statistical analysis. Coming to the results, most common source of drinking water in the present study was found to be municipal network, which was somewhere 76.6%. And this source of water was received by majority once in 2 to 3 days in a week. Only 1/3 of the households treated water before use. And only 25% of the households had some form of purification system like filter. Others used boiling. Nearly 98%, 97% of the households perceived taste of water as acceptable and above that, like excellent, good, and only less than 3% of the people in the households perceived drinking water, whatever they are getting, as unacceptable. Majority of the households had individual toilets and 17.6% had access to community toilets, and the rest 7 to 8% were practicing open air defecation. 39% of the households had stagnant or sewage water near their houses. 33% of the households had piles or collections of dumped solid waste near their houses. And in these houses, solid waste was collected once a week.
So, sorry, but you have 1 minute left.
Okay, ma'am. Coming to the second objective, hand hygienic practices. Majority, more than 95%, practiced hand washing after using toilets, followed by more than 85% before meals, and also more than 60% practiced before cooking. As per third objective, we also tested association between diarrheal episodes, both among children and adults, with some of the environmental factors like purification of water, stagnant water near house, solid waste piles near house and toilet. And it was found that solid waste pile collections near the house were found to be significant. Coming to the conclusion, proportion of households having access to safe water and adequate sanitation was satisfactory in the present study. However, there was need for improvement in the hand hygiene practices. Diarrheal episodes among people in households were significantly associated with solid waste piles near house, thereby emphasizing the need for implementation of timely and appropriate waste disposal methods. These are my references. Thank you.
Thank you, sir. Judges can start.
Vijay Kumar, it was really a very good presentation, and whatever I was looking for is present in your presentation. So no questions from my side. Yeah.
Thank you, sir.
Yes, same good presentation, and household survey is also good technique using the global the questionnaires.
Yes.
Global WASH cluster questionnaires.
Thank
You commented that it was satisfactory. Did you use the scale for that, or is it on the results you are trying
On
to
the results, ma'am, up to 75% and adequate sanitation, ma'am.
Okay, so that's in the scale itself which you have used. Is it a cutoff that is given, or you have?
They haven't given any cutoff, ma'am. They haven't given any cutoff.
Okay. Yeah, that's what. And I think always such studies should be reciprocated back with any type of intervention. So I think you people would be planning for that. So
Yeah,
that
ma'am.
would be a good thing. Yeah.
Okay.
Yeah. Thank you.
Thank you.
Thank you, sir. Thank you, judges. Now let's move on to our last participant, Dr. Chandani. I'll be giving the control to you.
Okay, yeah, thank you.
Chandani, please be brief.
Yes, sir, I'll try my best.
Ma'am, you can present now.
Yeah. Slides.
Yes, ma'am, they're visible. The slides are visible. start.
I am Dr. Chandni, professor from Community Medicine Department, Prakash Institute of Medical Sciences, Bangalore. My study is a cross-section study on the perceived stress and its association with body mass index among undergraduate medical students in a medical college. The introduction: stress in itself is not an illness, but a chronic condition.
Little louder, please. Can't hear. Little louder.
Can you hear me now, sir?
Yes. Now I can.
It's a chronic condition in which of the individuals. It's one of the important environmental factors associated with obesity. Undergraduate medical students have been the most distressed group of students because they're expected to learn and master a lot of skills and knowledge in a very short frame of time. The amount of material to be absorbed, the social isolation, pressure of the examination, discrepancies between expectations and reality with little or no time to relax in between, they can all be anticipated to bring about physiological stress. Studies have classified sources of stress among students into three main areas. One is academic pressures, social issues, and financial problem. Chronic exposure to stress can lead to various health problems, especially many non-communicable diseases, and even psychological complications like anxiety, depression, substance abuse, and alcohol can also result in suicide. The biochemical basis of stress resulting in change in body weight is the level of cortisol. Higher the level of cortisol, bigger the body weight, BMI, and the waist circumference of the person. Stress can result in changes in dietary habit, particularly in adolescents. In some people, it tends to gain more weight, and while others tend to lose weight. So this association between stress and weight change is less clear. So especially in this demographic, and hence this study was carried out with the objective to determine the prevalence of perceived stress among undergraduate medical students and to assess association between the levels of stress and gender, MBBS academic years, and BMI. This was a cross-sectional descriptive study carried out among undergraduate medical students from first to final year MBBS in a medical college. Ethical clearance and written informed consent was obtained. Sample size was calculated to be 579 based on the prevalence from previous study of 75.3%, the precision of 5% and 10% non-response rate. The tool that we used was the standardized 14-item perceived stress questionnaire, PSQ-14. The perceived stress scale is the most widely used psychological instrument for measuring the perception of stress. It is an accepted parameter of stress, and it is considered to be sound based on psychometric principles. This consists of 7 positively stated and 7 negatively stated items. The scores ranges from 0 to 56, with higher scores indicating higher level of stress. The exclusion criteria was chronic absentees, refusing consent, and those with already diagnosed psychological ailments and who were on treatment. Pilot study on 19 students was conducted and they were excluded from analysis. Method of data collection: a list of undergraduate students were obtained from their class registers. The total number of students were 679, out of which 66 were not available at the time of data collection, and after 2 attempts to trace, they were excluded. The data was collected by population in batches of students. To explain about the study and method of filling the questionnaire, they were given adequate time to fill the questionnaire, which collected data on A6 and perceived stress index. The students were made to sit separately, and any doubts while filling the questionnaire was addressed at the same time by the investigator. After completing the questionnaire, the students' weight and height were measured by the investigator by a standardized technique, and BMI was calculated using Quetelet's index. Underweight, overweight, and obesity was classified using WHO classification for the Asian population. Coming to characteristics of the medical students, you have the typical adolescent age groups ranging from 17 to 28 years. There was almost equal prevalence of males and females, and we found more students in the first and second year MBBS who participated in the study. The prevalence of stress reported in this study was about 57.7%, and though the female students were more stressed compared to male students, this was not statistically significant, but stress was significantly associated with MBBS academic years, with final year students and first year students being stressed more. Coming to the perceived stress, more 55% of them said that it was because of fear of exams or academic pressure, with other reasons quoted here. Most of them used coping strategies, sharing with their family and friends, sleep and music to overcome this.
You have 1 minute left.
6.6%. 6% coped up with using negative coping strategies. Coming to the relationship of BMI with stress, we found 20% of the students were underweight and 22% were overweight and obese categories. The amount of stress was more both in the underweight and overweight categories, and this was significantly significant by chi-square. The Pearson's correlation coefficient says that there is a strong positive correlation between stress and BMI. Globally, study reports stress range 20 to as high as 95%. The major cause of stress were the same as reported in this study, that is academics. And in Karnataka, there was a study conducted on 251 medical students, which quoted that a very high percentage of students who consumed alcohol and smokers had experienced severe stress. There is a strong belief that stress levels can influence eating habits and can affect weight gain and BMI. And weight status prior to the onset of stress is found to be more predictive of the individual response. Conclusion reports a high prevalence of perceived stress, and academic pressure was the most common reason cited. Significantly associated with MBBS academic years and BMI. Recommendations to overcome stress by social support of family, friends, teachers, and counselors. Monitor or alcohol, tobacco, and drug practices, and provide health education. Stress releasing recreational activities and exercises should be encouraged, and the college should provide as much as possible a stress-free environment. Limitation of the study stress questionnaire data self-report.
Sorry, ma'am, but your time is up.
Bias and all bias. Okay. Okay, sir. That's it. Limitations.
Run through the slides. Run through the slides, please.
Limitation. It was a cross-sectional study,
Okay,
so
fine.
Could not be assessed.
Fine. Chandni, it was a good presentation. Only one question I have is, I have not understood what is stress so far. Can you make me understand in simple words what stress is?
Psychological reaction to any event in life, sir. The kind of stress that I would, a kind of stress which I would consider as stressful may not be stressful to other person. That's why we have measured the perceived stress.
Still, I have not understood. See, my purpose is I want medical students to understand what is stress, because stress is such an important risk factor for so many, health problems. So we want students to understand stress. How do you make your students understand what stress is? That's what is my question. Otherwise, your presentation is wonderful. I liked it. But if you don't understand what is stress, or you are not able to make students understand, then it is, for me, not good.
Explain to them, like it's basically a response, physical. It could be any kind of response. It could be a physical, mental, or emotional response to any kind of body or mental tension. That is basically.
Okay, I will just, I have not understood really. Honestly, I have not understood. I will just tell you, okay, this is how I try to make students understand. If you are working very hard, okay, for something that you don't care about, okay, that is called stress. Okay, if you are working very hard for something we love and we like, okay, that is called passion. So the difference between, maybe this is how I make them understand. I have not understood really. Okay, so I want
like to do, need to do, or like
exactly.
To do. Things,
Yeah, if you, maybe people are working 20 hours, but they don't feel it as stress. People are working for 20 hours, they don't feel it as stress. Like Modi is working for 20 hours. He doesn't feel it as a stress. He loves it. He loves it. He likes it. Okay. But somebody who hates and we are forced to do that, then it is causing stress. You understand? Simple. Like I want you to make, this is not the definition. I want you to make things very simple for the students to understand. Okay. And you said 66 students were excluded because they were not available.
Yes.
Does it affect your result? I just want to ask you, does it affect your results? So what measures will you take? What measures are available to ensure that it doesn't affect the results? Anyway, please go and find out. Okay, Dr. Shailja ma'am, you can take over.
Dr. Chandni, yes, you did try to put a lot of information in the presentation. I do agree. And it's a good topic, relevant for present scenario with so much of stress going on. So PSQ 14, you told, no? PS
Yes.
14. Is it available free for analysis?
Yes, ma'am.
Only the scores are available.
In
Because,
the entire question, actually, there is a 28
no,
question.
yes.
You
How to
have,
analyze,
scoring from 0
because
to 4.
I know. Please understand my question.
Okay.
What am I asking is, higher the score, higher the stress. That is a very general statement when you calculate. But how to calculate scores and how to really interpret them? Is it available free?
Ma'am, we have to do it manually, ma'am. It is there available free, ma'am. The questionnaire is available with the options. Each question will have 4 options. In those 4 options, they are scored from 0 to 4.
Yes.
So they
Have
are
you seen
positively
GHQ?
stated.
Have you seen GHQ questionnaire, General Health Questionnaire?
Yes, ma'am, I've seen.
Is it free?
I don't know, ma'am. I haven't used it till now.
Yeah. Why I'm asking is, please find out that these questionnaires are there, okay, on the web, and there are scores in front of them. But how to analyze? They are all paid, okay. So when you just manually aggregate the scores and tell higher the score, that's a very vague interpretation we do have. But ideally, we have to purchase them to have a correct analysis and this one. So when next time when you are like using the scales, be sure that how they are how they have to be analyzed with the scores. Because we use them very casually. Most of the people use in different papers, so we start
Many
using them.
papers,
So
yes, ma'am.
yes, I do. It is not your fault. I'm just telling in general to
Yes,
everyone
ma'am.
who is on the session.
No, ma'am, I think
When we are
I was
using
really
the
not
scale.
aware about this fact, ma'am.
Yes.
Thank you.
So please, yeah, sir.
This, ma'am, definitely.
Yes, no problem. So this is one thing I wanted to suggest. Otherwise, yes, including the students and other things is good. It's a one college study, so again, generalizability will come in a question if you want to publish it.
Yes, ma'am.
Yeah, but
That is one.
do include some intervention measures and make it a big study and try to
Yes,
publish.
ma'am.
That
Yes,
would be a good thing. Okay.
Yes, ma'am. I'll
Nice.
do it, ma'am.
Okay. Nice presentation. Thank you.
Yeah, ma'am. Thank you.
Thank you so much, ma'am. Thank you, judges. We now come to the conclusion of our event. I'd like to thank all the participants for their time and effort to make this event very knowledgeable and informative for us. I'd also like to thank the judges on behalf of the entire CatchCon committee to make this session so insightful and for your valuable feedback. Would the judges like to say anything before we conclude?
How do we have to send our this one now only, or can we send it afterwards? What is the requirement, sir? I'm Kulkarni sir.
Even I want to send little later because we are right now late also. I have to rush for my next assignment. Maybe after 1 hour, 2 hour, if we send, is it okay?
Yes, sir. It's okay, sir. No problem. Sir, we'd also like to take a group photo. So I request everybody to turn on their cameras.
Okay.
Ma'am, can you stop? Chandni, ma'am, can you stop presenting? Yes.
Yeah, general.
One second.
You must make your slides attractive, good looking, okay, so that the audience is forced to look at your slides, right? So don't overcrowd the slides. Don't write so much of information in one slide. Okay, only few points and explain that. That's important. More important than the looks is always the content. Okay, what content is there in your slides? Once we are attracted, we will definitely go through your slides. Then the content matters. So therefore, content has to be very good. And more important than the content is how you explain, how you present. Okay, that's important. So these are 3 points I just wanted to repeat because this is very, very important for all presentations. Thank you. Dr. Shailja, madam, you want to say something? Ma'am is not saying, just take a photo quickly. I think she has
Yes, sir, we have taken the photograph. Thank you so much, sir. Thank you to all the participants and attendees. Thank you so much.
Thank you so much.
Also, can we also get a copy of the photo, please?
Yes, sir, definitely, sir.
Send it to our mail.
Yes, sir, definitely, sir.
Okay.
Can
By evening,
I
we will
log
send you
off?
the. Yeah, even I want to log off.
Yes, sir, you can, sir.
By 5 o'clock, we will send you the score. Is it okay?
Yes, sir. Yes, sir.
Okay. Thank you.
Thank you so
Thank
much,
you.
sir.
Yes.
Thank you, ma'am.
By mail, right?
Yes, sir.
Thank you, ma'am. It was a pleasure,
Thank you,
again judging along with you.
Yes, sir. Me too. Same here, sir. Thank you.
Thank you. Thank you.
Thank you.